Okay, so when I have a client with a stiff wrist referred for therapy after a distal radius fracture, one of the concepts that I like to show the client is, and I'm showing them on my arm. This is not a client. This person does not have a stiff wrist, but my model here. I would show them that ordinarily with a normal wrist movement, you bring your hand down this way and you put these tendons on stretch, but you have slack to these, and then vice versa. You go this way, these tendons are on stretch and you have slack here. You've been in a cast for 6 weeks, you come out of cast and you're very stiff and there's just not a lot of slack either way. So when we first start therapy with a client with a stiff wrist, the therapy for range of motion really is not about joint stiffness, because we can't even get to much joint movement. We are stretching out the tight tendons on both sides, and even in a lot of cases the connective tissue, including the skin. So when you're doing range of motion, again, like we talked about with fingers, you really want to give a lot of support when you're pushing on someone. And as you go down, usually before the client would even have to tell you that they've reached a point of, where their pain tolerance is as much as they can stand, you can start with your fingers here. You can feel those tendons kind of twittering, and so you know that you're going to have to kind of stop and give pause there for a bit. And depending on the client and how long you've had them in therapy, and if you've started to make any progress or not, you might just relax and kind of come back to the start. Although I don't tend to work back and forth. You're warming up the tissues, and so I would stick with one direction. If I'm working into flexion, even if I come back to a relaxed position, then I'm going to come back down into flexion again and do a few repetitions that way. Depending on their tolerance, or after you know their tolerance a little bit better, then you might go a couple of successive times. So I start out and go to a point and then relax, and then maybe see if I can go a little bit further. Might do that a couple times, or relax and take a little bit of the tension off, and then stretch again. Okay, and then same thing. When I work into extension, sometimes I'll kind of think of the wrist extensors, wrist flexors and extensors separately. So here I'll let her fingers relax, and so I'm stretching more on the wrist flexor tendons here, and I might do a few repetitions that way, and then I'm going to stretch her again, but with her fingers straight. Okay, in the clinic, of course, we have some nice pads in the clinic. You do want to be kind to your client's elbow. Stretching into pronation and supination might be a little bit more difficult. You might have to kind of play with your hand and arm placement. You could even get them to help, hold down and stabilize as you're trying to work into supination or work into pronation. Okay, so another strategy, and this is certainly not something that you would do in the first week or two of therapy with a client for range of motion after, say, a wrist fracture, stiff wrist, but you can use a weight, not for strengthening necessarily, but for range of motion, just to kind of pull down into the stretch. And so you could get them to guard, or to kind of spot, or you could do for them, and then let the weight stretch. So here we're stretching our extensors. I do think it can be a good thing to, a lot of people will say, use a can of canned goods. I do think it's a good thing to try to get this additional finger flexion by holding something more slender like a weight like this. And so, we could do a few reps this way, stretching. As with the other wrist range of motion, I would tend to not go back and forth. I would keep stretching in one direction. As long as you're getting those tissues warmed up, you might as well take advantage of it and keep working the same direction. So in this case, we're going to continue working flexion. Okay, and then after we worked our flexion, We can come over into extension. Now, this is my model who doesn't have limitations, but with a client, they might have very limited pronation, supination, and they might have to stand up and lean into it. But again, just letting the weight help pull them down into flexion.